Thank you so much for taking your time to meet with me today. Give advice to any other students or like what you want to start a conversation?
Well, I'm an old man. I have a lot of words of wisdom. So I think I should follow your leads and then maybe at the end I can have concluding remarks.
Yeah, the first question is what just inspired like you to pursue general surgery as a career?
That is a really good question, Lawi. I think what inspired me to choose general surgery as a career is growing up, I've seen a lot of people that actually needed general surgical issues that could not have their issues addressed, and they would actually live with a lot of challenge and suffering, and obviously without any relief from that disease. I see them pass away. And when I went to high school in Ethiopia, I tend to love, obviously, I never forget those people who I saw with all those horrible pathologies, which some of them are actually my relatives and our neighbors. So as I was going through school and realized science was my strength and mainly anatomy, and it just really came handy to actually think of a profession that actually I can do something to alleviate people's suffering. And really, I see a result immediately. That's super fulfilling.
That's really inspiring. 'Cause I feel like in high school experience and what your interest is, if you find out early and you work on it, like as I was trying to do the past few years now, I'm a senior. It really helps shape your goal a lot, especially like to go into a career like that. Yeah, it's very powerful. Yeah.
You're absolutely right. The sooner you think of what you want to do in life, and the sooner you focus, especially in high schools, the last few years of high school are the shaping moments because you do get exposure to lots of science, and it does guide you, and of course it puts you ahead of the ball game, because if you really have done your job toward end of your high school, you will have a good enough grade that will get you to the good college, and then the path continues. So there's nothing like a focus, and there's nothing like planning.
Yeah. Was there any moments in your training that like tested your commitment to medicine or like made it challenging?
Yes, yes. I have to tell you, coming from Africa, in fact, I went to medicine many, many years ago where there's not many members of Oromo or Ethiopians community around here. I was also going to medicine while I was married. In fact, halfway through medical school, we had run. And medical school demands so much of your time, so much so to the point where you pretty much don't have a time for your family sometimes. And yes, I did questions. I did not really. I was, asking myself, is this worth it? I mean, I'm not spending time with my wife. I'm not spending enough time with my baby child. And yeah, there were quite a few times that actually made me questions if what I'm doing is the right things, because of the challenge it imposes on you in terms of time availability. And then there's also other times where we go to medicine to cure. We go to medicine to alleviate the pain and suffering, and you go to medicine to actually do so much good. And it's not always that way. There are always, there are days here and there where, unfortunately, you lose a patient, someone that you've been caring for quite some time. So you bonded in some ways, and it hurts. And you kind of ask yourself, it's a challenging moment to lose a patient that you've invested so much on. And so those kind of situations have definitely made me rethink this. Am I in the right place?
Medicine can definitely take a toll on you, especially right now. I'm in a health sciences class. Like we were watching this documentary about these like Harvard Medical School graduates, and a lot of times the people they're like married and also they have kids, and it's very hard to like because the hours are very long and so is the training, but it's also really worth it because it's a very valuable job and it's
Yes,
rewarding too.
you're right.
With a lot of sacrifice.
Okay.
Mhm. Like, what do you think is the process of becoming a board certified surgeon look like step by step? Like, what do you think?
Yeah, well, I think that process is it takes a few steps. I don't say long, but it has to be planned. Like we said, you need to plan this from early, from high school on, because mind you, you have to do fairly well in high school to get into a good college and so forth. So you have to finish four, of course, 12 year of high school and 4 year of college and get a bachelor's degree, preferably in science fields. There are people actually who gets a bachelor's degree in English and psychology and still get into medical school if they performed well. And after 4 year of medical school, general surgery is 5 years residency. It's pretty intense, 5 years, but it's very rewarding, like you said. And in my case, I had to do a fellowship, which was one extra year. So it has been a blessing years. And obviously, when you sit at this stage of your life and look forward, it seems too long. But when you're going through the process, knowing that you're doing this for a good purpose, and you do enjoy the process because every step of the way, there's a lot more joy than otherwise. So, all these years that seems so long, looking forward now, as you go through it, and when you look backward, and it's actually a time well spent because you would have spent that time doing nothing anyway.
Yeah,
Yeah,
exactly. Yeah,
yeah.
because a lot of times people, when someone says they want to go into medicine, they're always talking, oh yeah, you're gonna waste your life being in school for that many years, but those years are gonna pass by anyway, so you might as well like do something meaningful, and then for the rest of your life, it's gonna be very rewarding to look back at the work too, and I'm sure like you feel that way too.
You're absolutely right. I think as I look back, um, of the years that I spent training, preparing to be a surgeon, and benefit that it has given me to serve God and to serve humanity, I couldn't have picked anything better. I think God have blessed me and my family to actually really work through this amazing field of medicine to heal and touch and change a difference and actually produce so many educational opportunities because when you receive enlightenment, you cannot help to give that back, especially when you are God centered, because it's really God that actually guides our soul to do good. It doesn't matter how humanity wants to, whatever you do as an humanity, there's a shortcoming. But when you center your life with a God centered life, and God gives you a tool such as a medicine and surgery, the what how you can change or God will change the world through you is beyond anything that you can imagine.
That's really that's really powerful. What was your like biggest challenges during medical school and residency?
Well, like I said, the time management is always an issue. If really learning to manage your time, and you have to spend time with a loved one. As you know, I have a large family. There's always a wedding here and graduations here, and you kind of feel left out when you don't attend any one of those. And my own wife and kids, and other things that you want to actually, beside the medical school, you want to do. You want to make a time for this, and it's not always possible because there are some times where emergencies comes that you're accounted on and you have to take care of the patients. So just really managing your time to deal with your family as well as take care of a patient. It's always a balancing act that actually you have to work on. It's not easy, but with the practice, with time, it becomes easier.
Mhm.
And again, losing patience is not something we want to see. It doesn't matter um, how hard you work and how much you do. There are patients that come to you in a late stage of their disease and who tend to not really survive the extensive treatment that we offer them and actually we give them. And losing patient is something as a doctors, especially surgeons, we just absolutely affects us. So managing times and having challenge with the, very rarely having challenge with the patient outcome that actually is different than what you desire does make things harder. But again, that's a minority of a time comparing to an incredible joy of a profession that what profession offers you to serve humanity, patients, and even your own family. So I'm incredibly happy choosing the field of general surgery as my professional career.
It's very respected, and also like you're helping a lot of people and people will look up to you as well. Like even you especially like in the Ormo community, every time when people hear your name, like they always look up to you and like people really value you as a person and what you do especially.
Definitely is humbling. That's really the way you need to take because it's when you make this about you that become a failure.
Hmm.
And we know this is all beyond me. It's about God and all the love that surrounds me. That actually gives me an energy to do more, and the love of family and the power of God. It energizes you to really go forward. So it's an honor to serve. It's an honor to actually help as much as you can. And you want to be very careful when people actually trying to elevate you.
Yeah.
You got to take that with a grace, and that's really for God and others, not you.
Yes.
So I take it that way. But thank you. Yeah, I'm very blessed to serve the community with what
Hmm.
I can.
Yeah, it's definitely, first of all, it's very much a job of service for sure, because the whole point is you'd go through all those years to train and then serve others. And that is the way like it's supposed to go. You're just supposed to think of it as service. Yeah, you're right. Looking back, is there anything you would have done differently, like in your training?
Um, there was always, as you look back, you would always think of a very moment that you say to yourself, I wish I've done this and I wish I've done that. For most part, I'm very, very happy with my path that have led me to today. It has been just an incredible journey. Coming from the rural town of Ethiopia to where we are here, and how God has used us to actually serve here in America as well as back home. It's just a blessing, a tremendous blessing. If I have to look back, what could I have done differently? Actually, I wished I've gone back home sooner to do what I'm doing now. I think God is using us in so many ways to do so much good. And had I gone a little bit sooner, could I have done much better? Or could I have reached more people? This is the kind of thing you say because you see where the service is most needed. I run a very big trauma center here in Los Angeles. In fact, the third busiest trauma center in Los Angeles, and very successful. We built it from a ground up, and we have hundreds of surgeons and subspecialists working for us. And you say to yourself, yeah, it's great we've done that here in Los Angeles. Um, Maybe God could have used many, many other surgeons here in Los Angeles. Maybe had I had an opportunity to go back to Ethiopia, maybe started earlier. Could I have done better than what we have? You always think of things where
Yeah.
you could have, yeah, but overall, God has blessed us, blessed me in my family with the entire process of coming from uh, Ethiopia to here, settling, working together as a family, supporting each other, and taking everything in perspective, good or bad, and being there for each other, and not leaving a family behind as you actually build on your career. Because the mistake people make is they think, let me just park my family and carry on with my profession, and I'll come back to the parked family. It doesn't work. I think it's always good to carry on these amazing missions with your family cheering you on. And I've had that joy and pleasure of having the most loving family that always stood by my side. And during the rough and tough times, they became the pillow and the cushion I had to land on. And I was so blessed to have that. And those kind of things takes you a far distance and long way with God's support.
That's really valuable. Do you know what's the most like challenging part of your work?
Well, there are a lot of challenging, as you know, medicine and particularly surgery
Yeah.
is a science-based, it's an evidence-based environment. There is no completion of the training. You're always learning.
Yeah.
As a general surgeon and trauma surgeon, you think after 7 years of training, you've completed your course. Actually, absolutely not, because it's an evolving evidence-based research. The research changed, the science changed. You have to adapt to them. So just recently, in the last 3, 4 years, we adopted surgery with a robotic assistant. And we're doing a minimum invasive surgery. And laparoscopy has been a standard, which actually through tiny holes, we do a major operations.
Mm-hmm.
And as a technology changes, you have to change with them. And so it's almost like going back to class all over again, even though you know the anatomy and the physiology, the surgery, but using the tools that you use to perform even better operation that are good for a patient are an ongoing process. So therefore, I wouldn't call it challenges. I think it's an exciting opportunity for surgeons to always sharpen their saw, sharpen their skill as they
Mm-hmm.
improve their technique. So that's one of those things that doesn't make you lazy, and
Yeah.
you just don't feel how you parked your car. The car is always moving.
Like, I know this is not part of the questions we planned, but like, as AI is also growing today, like in a lot of careers, do you think it's like a lot of, it's a part of a lot of your in your job, like in your daily work?
It is. It is. Actually, robotic surgery is already here, and I do advanced robotic surgery. In fact, we do gallbladder, laparoscopic gallbladder. Now we're doing robotic assisted. And hernia without cutting people open, we can fix both sides with just a tiny hole with the robotic assisted. We're doing anti-reflex, when people actually have a reflex disease or their stomach up in their chest. And
Mm-hmm.
all days we used to make a big, big cut. That is gone. Now I'm doing these major complex operations through tiny 3 holes. And the
Wow.
patient go home the same day or the next day as opposed to staying
Wow.
7 days in a hospital. So, we do goiter surgery and, of course, the colon cancers. We used to open people. I mean, now we don't open anymore. We do those through with those 3 tiny holes. We remove a cancer, we connect them. The next day they're eating, and 2, 3 days they're going home, as opposed to staying in a hospital, 7 to 14, 15 days. So the AI is changing our way. And then there's what they call a telemedicine. And now we're doing telesurgery because of robots
Mm-hmm.
and AI. I can sit right here and do operation farther away from me. And I think the days where I will sit here and do surgery in Ethiopia is not too far either. So it's incredible.
Wow, that's really amazing. Honestly. Feel like that's gonna change a lot. Like, I wonder how school is also gonna change for that as well. Because I feel like you're still gonna need the skill, because it's really important to have doctors, especially with that skill, because of how long the schooling is. I hope hopefully like even with the robots, we could still have that work-based like that challenge to get there because it's very like it's an important field where we need the right people and not just like, shortcuts and stuff. But it's really good, the technology and everything, but there's still the skill too, right?
You're absolutely right. Remember, robots will never replace humans.
Mm-hmm.
Now, robots would be a tool that you use to do surgery, to do procedure. So, as long as we stay on top of our skill and we know our science, no robot is going to replace you, especially field of surgery. Now, in a primary care area, maybe, but in a field of surgery where actually your skill cannot be, almost rarely can be replaced because, yeah, we can simplify the surgery. Maybe we can do a lot more surgery with one person as opposed to, many surgeons doing the same number of, because the robot definitely helps you do quite a few surgery without you fatiguing because you're sitting far away. Now you're using this tool, robotic hands, that you've actually placed inside the patient's abdomen or whatever you have to actually manipulate exactly. You are manipulating them. You're doing
Mm-hmm.
surgery with them. And without fatiguing, without being tired, you tend to do a lot more operations. So, yes, there might be maybe a little less surgeons as opposed to the number of surgeons we have now because of AI. But at this point, we've been wrong before, but at this point, in medicine, we don't think surgical field will be replaced by robot.
Yeah, for sure. Yeah. Yeah, for sure. I don't think that's gonna happen, but yeah. Do you have any advice for like high school and college students who are like first generation and like they're like the first person in their family to like go to college and are looking for mentors? Like,
Yes, absolutely. I think the first thing is exactly what you're doing. Just having developing interest, an area where you want to serve. It doesn't need to be specific. As long as you know you're interested in healthcare, you will figure out as you shadow and mentor. You need to find a mentor wherever you are. There are a lot of them. You just need to know. It might not be in Portland, it might not be in Minnesota, it might not be all in Los Angeles, but someone will actually guide you to a mentors who are willing to show you the way. Uh, Spend a time with them, especially if you're interested in general surgery. Go to an institution that actually general surgeon will allow you to shadow them. You can
Mhm.
follow them in a clinic. You can follow them in a surgery day. You can follow them on the follow-up days because you would see what they do. You would see the patient that comes for surgical needs, how those patients are assessed, and then how surgeons are preparing them for surgery, and then how they're doing after surgery. That way, it just really gives you whole uh, circular versions of the disease to a cure. And the same in other fields. I think especially in a junior year of high school and senior year of high school, is the time to actually shadow a clinician somewhere. And if you haven't got that chance, definitely do it in college because it's really, really vital. Because they will not only you will not only see what they do, they
Mhm.
can give you pearls of wisdoms that actually would guide you in terms of what you should be studying, how you should be preparing for this course, how should you be preparing yourself actually to march into that area if you're interested.
Mhm.
So, really finding a mentor and shadowing them, why not for 2 weeks? It really adds a huge value. I highly recommend that, and doing well in high school is very important. I think it's a really, to me, that's a priority. Really focusing and doing well academically in high school because that will help you build a habit of studying
Mhm.
and managing your time well as you go to college. Because most people kind of goof around a little bit in high school. They get a senioritis and then you get to college with that habits, and then really kind of learn the culture of procrastinations,
Yeah.
postponing things to tomorrow.
Hmm.
So my advice is don't postpone. Do what needs to be done, not only today, now.
Yeah.
When you get into that habit of, I'm going to do what I need to do now, you've already prepared yourself to be a good medical student down the line.
Hmm.
But if you are procrastinators, that would actually follow you. And
Hmm.
that's the first thing you need to eliminate out of your life to really be a successful person. Whatever that you need to do, there's no reason to postpone it. You need to actually, if you're not complete now, at least start it. That way, you're engaging, you're committed, and you will eventually finish. So those sort of things, and then also talking among the peers who are like-minded, like you, because it really matters. The peers can affect you to actually, in terms of distracting you from your course, and hanging out with those who are like-minded is very, very important. So I think for now that's my suggestions.
Yeah. I feel like, yeah, it's really good finding your interest early. Like maybe if it's not even healthcare, like just joining everything you can, which is exactly what I was trying to do, especially like you could just check your area of all kinds of like volunteering opportunities, mentorships, or even like summer camps. Like it doesn't even have to cost money. You can just even ask your school too, and they could help you. Like that's what I've been trying to do as well, like counselors.
That
And
that's exactly you figured out. That's absolutely excellent. You're right. There's, I'm sure, all types of resource in your school if you tap into it. And
yeah,
there are a lot of people who wants to show you a path to success. Sometimes we don't get it because we don't ask.
yeah, exactly.
Yeah,
Just being quiet. The only person that's limiting is just yourself, honestly. Yeah.
you're right. You're
Hmm.
right.
What do you think the field of surgery is like going to be changing in the next 10 to 20 years? Like,
Well, in the next 10 to 20 years, I don't know what it's going to be
yeah.
because the robots are already invaded our
Mhm.
our space,
Yeah.
and like I said earlier, with the expansion of robots and AI, telesurgery and telemedicine are going to be expanding. It
Mhm.
has expanded in radiology already, and it has expanded in a lot of primary care already.
Yeah.
I think it's going to enter into surgical field with advanced technology, advanced imagings, advanced instrumentation that we use for surgery, such as robots and others. I think those are the direction that actually we're going to see significant change.
Mhm. I think you think like this summer I also went to like this medical assisting camp in like our local community college, and we were talking about how like the birth and death rates were going like the numbers were changing, and I think it was like with the new diseases we get every year and like all the different choices people are making, I feel like maybe AI could also change that in a positive or a negative way a lot. You think that's true or?
I think so. I think so. It's an amazing what AIs have managed to do in such a short times.
Hmm.
I tend to think AI is going to change things positively as opposed
Yeah.
to otherwise.
Hmm.
I think a lot less negative and a lot more positive
Yeah.
in terms of improving quality of life and improving patient outcomes, improving patient safety, and so forth, because it's kind of going to take away a lot of human error.
Yeah.
And I think that's good.
Hmm. Yeah, I feel like it's a really good change, but I feel like sometimes I think it's better. It's good for like medical field and like different careers, but like just regular daily life, just depending on it is also kind of bad too. Like, 'cause some people I see like nowadays nobody can even write their own emails or do their own schoolwork. And I feel like that's gonna be a negative thing, but if we use it for the right way, it could be a great tool in the future.
You are absolutely right. That we, I mean, Alawi, I think, um, that's really where we have to watch out what we do.
Hmm.
I think in the era of AI, there's nothing is hidden. Everything we do is public.
Hmm.
So as long as we're very careful with our behavior, with our activities, you might be better off. But you're absolutely right. Those who actually, it's going to affect your privacy and private life, and there's nothing secret anymore, and everything we do is out and open.
Hmm.
That is a bit dangerous, depending on how how we behave in our life, because um, there's there's a pretty much a complete exposure of our life to a public, and especially to those who actually controls our life.
Yeah. Even now, like if you just type anyone's name, it just searches all their online history and everything. And it's kind of scary, but as long as we're careful and like not typing our own like identifiable stuff is fine. But I
You're
guess
right.
there's always limits to things. Yeah.
You're right. You're right, Lawi. I'm very, very proud of you. Doing excellent things, and I want you to continue to shine. I'm very, very proud of how you've grown up, in grace, intelligence, the way you carry yourself, your siblings, and you lead them by example, and you support your parents, and the way you take a leading role in a family matters makes me very proud, and I'm very, very happy and lucky to have you as my niece. And anything I can do to support, remember, I'm there.
Thank you so much. Yeah, honestly, I'm lucky to have you as my uncle too.
All right, Bashatiya Jabat.
Thank you.
All right, love you much. Have a good
I love
night.
you too. Good night. See you.
Bye
Bye.
bye. Bye bye.